First of all, I'd like to apologize for not being able to join you in person today. As many of you will understand, the calendar of the European Parliament doesn't always allow us to be in two places at once. Still, I am very grateful to be part of this essential conversation, and especially like to thank IDA for hosting this important event, and all of you for your commitment to public health and trust and science. Vaccines remain one of the most effective tools we have to protect lives and to guarantee equity in our health systems. They are a cornerstone of modern public health, but their success depends not only on medical innovation or logistics. It depends on whether people trust them, understand them, and feel represented by the institutions that recommend them. Unfortunately, the reality we face today is more complex. Vaccine hesitancy is growing across the Union, and is not simply the result of lack of access. It is being fueled by a digital environment where misinformation spreads faster than evidence, and where fear is amplified more easily than facts. We've seen the consequences. In 2024 alone, measles cases in the EU more than doubled. And this is not just a public health concern, it's a wake-up call. When trust erodes, protection fails, and we must face a difficult truth. Many citizens are not resilient saints. They are navigating an ecosystem where science is drowned out by louder, often more emotionally charged voices. This problem is not confined to our borders. It's increasingly global. It's a global trend and at times imported. In fact, we must recognize the growing influence of misinformation trends originating from outside the EU, particularly from the United States. Figures like Robert Kennedy Jr. and his Telegram channel, for instance, are sporting anti-vaccine rhetoric and pseudoscientific claims across the Atlantic. These messages, from conspiracy theories to false natural remedies like drinking raw and pasteurized milk as an alternative to immunization, are not only dangerous, they are seductive. They appeal to emotion, to distrust, and to frustration, and they travel quickly through social media into European homes, communities, and conversation. We cannot allow algorithms and influencers to shape public health narrative unchecked, and we must not allow dangerous trends from abroad to weaken the public health programs we have built there in Europe over generations. We need to empower the most trusted voices, doctors, nurses, teachers, researchers, and community leaders who can engage not just with authority and real data. And we must continue working with digital platforms to ensure that verified, science-based content is promoted transparently and that harmful falsehoods are flagged before they spread irreparably. The EU has a responsibility here, not to centralize control, but to coordinate our efforts effectively. We have tools: EU for Health, the Digital Service Act, the European Democracy Action Plan. Let us strengthen them, connect them, and scale what works across our member states. Because if we want to build patients' confidence, we must rebuild trust in institutions and in experts. This is not just about preventing disease. It's about strengthening the social fabric of Europe. It's about equity, science, solidarity, and dignity for all. So I thank you, not just for attending today, but for being part of a broader mission to ensure that Europe remains not only a EU of innovation and access, but a EU of trust and prevention. The stakes are high, but so is our capacity to act. Thank you once again for having me today. It's an honor for me to be here standing up our voice and European values.